Ifoma Ubadike, and I'm a family nurse practitioner student. I am going to be doing a head, ear, eye, nose, and throat assessment on you today. Is that okay? Do I have your consent to do that? Want you to look at the camera and tell me if I have your consent. And it's going to be on YouTube under Unlisted. Is that still okay? Yes. All right. Thank you very much. So I come in, the first thing I'm going to do is to wash my hands with my hand sanitizer. So I'm going to be cleaning my hands. So I'm going to start with the head assessment. So now the first thing I'm going to do is, as always, I am going to inspect her hair. I'm inspecting it for the hair distribution. I'm inspecting for texture. I'm inspecting the hair for any kind of trauma, lice, and rashes. So after inspection, then I go in, I'm looking at it for lice, I'm looking for the texture, I'm looking for any depression, any kind of hair trauma, lesion. I'm looking at the texture. So now the next thing is to palpate the hair. So I'm going to be palpating the hair. I am palpating it for any kind of any crusts, any depression, any hematomas. So this patient, there is no crust, there is no hematoma, there is no any depression, and I didn't see any lice. The hair distribution are even, and the texture is good according to the ethnicity group. So now the next thing I am going to be doing is the eye. So under eye, I am going to be doing a general examination. So I am a general inspection. So I'm going to be inspecting this eye for zonopatomas. So and the ptosis, and then I'm going to inspect the eyelids, conjunctiva, and the lacrimal system and sclera, and the iris and the cornea. So I'm going to be inspecting the eye. I'm inspecting the eyebrow and making sure that they are symmetrical and they're even. I am going to inspect the eyes inside and see, looking at the iris, the cornea, the lacrimal system, and the conjunctiva, and the eyelids, and ptosis, and the sphatomas. They are all even and good. So at this time, the next thing is the people reaction to light. So I'm going to use my torch, my pen light, and I'm going to shine the light on both, on the eyes. So when I shine the light on the left eye, the right eye is supposed to react, constrict. So that is, I'm assessing this time the people reaction to light, direct light, and the consensual light. So for my instructor to see me, so I'm going to be away from the camera, and then for me to do this, I need to turn off the light in the house and dim the light. But for the purpose of this video, I'm not turning off the light, so it's good to turn off the light when you're doing this. So direct light. So people is reactive to light, both conceptually and direct. So the next thing that I'll be doing is I'm going to be doing the visual acuity. So at this point, I'm going to be using my Seno chart. With my Seno chart, I will have the patient I will be standing 6 feet if I have this pocket one. But if I have the one on the wall, it has to be 20 feet for where I'm going to place this. But since I have the chart one, it's going to be 6 feet. And I'm going to start by covering the patient, or asking the patient to cover one eye at a time. So I'm going to do each eye separately, and then I'll do both eyes. Okay, so ma'am, will you cover your right eyes for me, please? So then I'm going to ask her to read. Can you read this for me?
Yes, CFD8J.
Okay, good. Can you cover the other eye and then read for me?
CDFHJ.
Okay, good job. So can you use both eyes and breathe for me?
CFD8J.
Good. So patient is 20/20 in both eyes. So because she's able to read this 20/20 both eyes and with that's 6 feet apart. So I'm going to be doing the confrontational under the confrontational, which is the visual field by confrontational. Each eyes I will do it separately and then do it together. So this one I will tell the patient to follow my fingers. So at this point, I'm going to be doing, tell you to, can you follow my fingers? Also, I'm also going to be doing the ocular motor movements. I am going to be assessing the extraocular motion. I'm going to be assessing the ocular motor, which is the cranial nerve 3, cranial nerve 4, the trachea, and then Anderson, the cranial nerve 4, and the nystagmus, accommodation, and the conviction. So I'm going to be assessing all this while I am with this patient. So I am going to ask you to look straight for me. So you look straight for me. So this I am assessing the convention, the nystagmus. So patient is looking and I'm moving the object, which she's normal. So with the ocular nerve and ocular nerve, which is the cranial nerve 3 and the cranial nerve 4 and cranial nerve 6. So I'm going to ask you to go follow my fingers or this pen with your eyes only. So we do side, side, and then we do the other one, like this one, then down on the side, down on this side. Patient is able to follow this. That means the cranial nerve number 3 and the cranial nerve number 4 and cranial nerve number 6, it's intact and it's intact and it was able to follow the extraocular motion. Then and the accommodation is intact. So the next examination that I'm going to be doing is called the ophthalmostic examination. This I'm going to be using my fundoscope, and with my fundoscope I'm going to be looking at one eye, both the left and the right eye, with the light also dimmed. I need to dim the light for this also. So at this point, what's this? Let me see it. At this point, one thing that we need to be careful here is the safety of this. So with this, you make sure that the light is on and the set it on to the patient. So my light is on. So you're going to be looking my right eye to my patient right eye, and because you don't want that awkward moment where your nose is bumping into the patient's nose. So, and then one hand is supposed to, if I'm looking at the right hand, sorry, with my glasses. So if I'm looking at the left eye, my left hand is supposed to be on the patient. If I'm looking on the right eyes, my right hand will be on my patient. So I'm going to take my glasses off. So I'm going to be looking, this is my patient's right eyes. So I'm going to be looking on the right hand, and this is my left hand on my patient. I'm looking for the red reflex. I'm also looking for the optic. I'm looking for the optic cup. I'm looking for the optic disc or cup, and then I'm looking for the cornea and the lensing. So those are the things that I'm looking for. So at this point, I am also going to go back to this other side. As I'm looking, I want to put my hands on the shoulder of my patient or on the head of my patient, so to be able to see it. So I'm looking at the red reflex and the optic disc. So at this point, I can see the red reflex and the optic disc, and it's intact, and I see the lens and the cornea. So, and then inspection, and I was able to inspect the eye vessels. So the next I am going to go to, the next one is the nose. So I'm going to the nose, which is the second one, which is the third part of it. So in this third part, I'm going to the inspect the nose. I'm inspecting I'm going to be inspecting it with the light, and I'm also going to check the nose if there is any kind of obstruction, anything that's going to prevent airflow on the nose. So I'm going to use some light. Let me use this pen light. So at this point, do you have any tenderness?
No.
So after inspection, the next thing is palpation. So I palpate from one side to the other side. I'm asking my patient if she has any tenderness to tell me any tenderness or pain. So now that she does not have any tenderness, I want to make sure that I inspect the inner, the mucosa, and the nasal deviation, and the turbinates. So I am going to look up. You tilt your head for me. So I am looking at the nasal deviation and the mucosa, and there is no any malfunction. It is red and pink. Then no tenderness, no, it's clear. Then I also want to check the airflow. So I close this side. Can you take a deep breath? Can you breathe with that one nose? And then I close this other one. Can you breathe with that?
Yes.
Then after this, I also want to check her sense of smell. So I'm going to ask my patient to close her eyes, and then I'm going to bring something to her and ask her to smell it and tell me what it is. Can you close your eyes for me?
Mm-hmm.
Okay, so I'm going to ask you to smell this. What can you smell?
Coffee.
Coffee. So, are you sure you can smell coffee? Yep. Okay.
Yes.
So, patient is able, her sense of smell is intact. So now the next part of our test is going to be the ear. So I am going to start by inspecting her ears, inspecting the outer part of the ear for any discharge. I'm inspecting for any tenderness, any pain. I'm inspecting to see if there is any lesion. So, and then I go down, I'm touching it, I'm trying to see if there is any tenderness. There is none. So at this point, I am going to check her cranial nerve number 8, which has to do with the acoustic nerve, which has to do with our hearing. So I'm going to close one part of the ear. I'm going to test them one at a time. So I'm going to whisper to her, then ask her, tell me.
Apple. Orange.
Good. So patient hearing is intact. So I am also going to do another hearing test, which is called the Weber test. So with this Weber test, I am going to take this fork and put it in the middle of her head and ask her to, she's supposed to hear it both sides. If she's able to hear both sides, then she has that is considered a normal finding. So, are you able to hear it on both ears?
Yes.
Okay, great. So this is what the normal find. It's normal for her to hear it in both sides of the ear. Then the next one is going to be the renal test. So in this, I'm going to put it on the mastoid bone. Tell me when it stops, okay?
Now.
Now, can you still hear it?
Yes.
So, I'm going to do it on the other side of the ear also. Let me know when it stops.
Now. Yes.
Okay. So that we said bone conduction is greater than air conduction. So the air conduction is greater than the bone conduction. So she is able to hear it because the bone conduction is greater than the air. The air conduction is greater than the bone conduction. So at this point, I'm going to use my otoscope to look into the ears of my patients. I'm going to be looking for the tympanic membrane. I'm going to be looking for the cone of light, and I'm going to be also watching the safety of my otoscope at this point, because you don't want if somebody bump into you to put this into your patient ear. So I'm going to be pulling her ears up and the back because this is an adult. So as an adult, I'm going to be pulling her head up and the back, then holding my otoscope in such a way that I do not have to bump into my patient with this. So I'm looking, and I can see she has just a little bit of wax in it, which is normal for us. And then she has I saw the cone of light and the membrane in her ears, which is good. I am also going to check on this side. Good. So it should be nice and clear, no tenderness and no redness. There is no tenderness, no redness seen. I was able to see the membrane. There was the some of the wax that I saw in there, which is normal with everything. It's not an excess wax. So now I go to the mouth, the throat, and the face of this patient. So at this point, like everything, we start with inspection. So I'm inspecting the lips, I inspect the lips, I'm inspecting it for any swollen, any deviation, any asymmetry, if it's symmetrical, if there's any bend onto the other side or not. I'm going to inspect the buccal mucosa, which is in her mouth. With this, I will have to put on gloves because I have to go into her mouth. I also, when I'm in there, I'm going to be inspecting the salivary duct, Genevieve. So, can you open your mouth for me, ma'am? So I go in there, I'm inspecting the buccal mucosa. I'm inspecting the salivary duct. Can you raise your tongue for me? So I'm inspecting salivary duct. I'm inspecting the Genevieve, the pigmentation, if there is any infection, and also inspecting the teeth while I'm there. I'm inspecting to see if there is any caries, any excess or dysfunction, and also I also have to inspect for hypertrophy. I see if there's any infection. So I go into her tongue. I'm inspecting her tongue. I'm inspecting the size, if there's any swollen papillae, and then I'm also inspecting for the strength of the tongue. Can I ask you to raise your tongue? Do this. I can use the tongue depressant and all that to check on the strength of the tongue as I ask her to bring it out. When I do this, I'm checking for her cranial nerve number 12. So to check if there's any deviation on this tongue on this patient, because that could be as a result of something else, a stroke or some other neurological issues. So I'm also inspecting for soft palate and the uvula appearance. So I'm going to ask the patient, I'm going to say So when she said I am looking inside, I am seeing her tonsil, I'm seeing her uvula. I want to see if see everything, if it's intact, if it's the same. So I'm looking at the appearance and inspecting, and then I can also ask the patient, can you swallow for me? Yeah, so because when she swallows, I'm also inspecting to see the posterior pharynges and the tonsil appearance and see if she can. So then next, I'm going to go to the neck. So now I will take off my my gloves and put in the trash. So I am going to go to the neck. Then I'm going to start the neck by range of motion. I'm going to ask you to flex, which is forward, hyperflex, backward, lateral motion, and then lateral motion, and then rotate. Rotate the whole neck. Thank you. So I haven't done that. The next is inspecting the spinal accessories. So I'm going to ask you to shred your shoulder, and then I'm going to put a resistance and see, can you do that for me? Okay. So patient is intact, there is no any other distance. So I'm going to also do the head turning resistance. So why, can you turn to this side for me? So while I am using the resistance, okay, then can you do this on this side also? So her spinal accessory nerve is intact, because if it's not intact, she will not be able to do this. So at this point, that brings me to the next one, which is palpating the lymph node. So I'm going to start palpating the lymph nodes. We have to use these 3 fingers. So I'm going to start with the preocular. The preocular is in front of my patient's face, ear, sorry, in front of the ear. So the postocular, I'm palpating for any lumps, any movable lumps that I can see. I can have our tenderness. Can you tell me if you feel any tenderness? Okay, that is what you're going to ask your patient to do when you're palpating for this. So in the back is the posterior. So I go to the back of the ear, is the posterior ocular. So I'm palpating for any lumps or any tenderness. So now that I've done with that, and the next one that I'm going to do is the anterior cervical. So the anterior cervical is right here. So right here is our anterior cervical. So anterior cervical, I am palpating for any lumps. Then the posterior cervical is right behind this. Right here is our posterior cervical. Then the deep cervical is the one that it's deep, we can see. For you to see it, you have to ask the patient to turn her neck to the other side, and then you'll be able to see that. Then you go to the submental. The submental is right here. The submental, I'm palpating for any lumps or any nodes or any kind of tenderness. Tell me if you feel any as I palpate. Yeah. Then the submandibular. So in the submandibular is right here by a mandibular. So I am palpating for any lymph or any node. At this point, I can also ask, can you open your mouth for me and close it? Yeah. And this, I am also testing her cranial nerve number 7. So, and then I'll go to the subclavicular, which is on the in the front of our, by our clavicular bone. So I'm palpating for any lump or any node or any tenderness. Do you feel any? No. Then the next one I'm going to do is the occipital, which is behind our neck. So can you turn around so the camera can pick you, so my instructor can see that. Okay, so here is her occipital, which is behind the neck, and I'm palpating for any kind of lumps or any node or any tenderness. Okay, thank you very much. So I am going to go to the trachea. So I look at the trachea, I'm looking at the placement of the trachea. I am looking for any node, any lump node, or that can be like a pea size. I'm making sure that it's straight line. It is normal node if it is non-tender and not movable. Well, if it's fixed and hard, it is a problem. Something is wrong. So, so at this point, I'm looking at this. Then it is straight line. It is in place. I'm going to inspect it. I'm looking at it. I am inspecting if there's any abnormality, if there's any deviation to one side, any asymmetrical. So at this point, I go ahead. I can also ask the patient to swallow something. So now, can you hold this for me? So because I'm going to be doing the thyroid. The thyroid is now what I'm going to be evaluating now. I'm going to ask my patient to swallow something while I begin to, I looked at it. Can you swallow something for me? So at this point, I'm palpating it. So it is always good for you to come behind the patient and you are palpating. Ask the patient to swallow. Can you do it? Can you swallow again some water for me? So if the patient has anything, you usually come out. You usually feel it when she swallows something, when she swallows some water or while you observe it. So this is the landmark where you palpate the thyroid, because I'm palpating if there's any goiter, if there's any abnormalities, any tenderness. So it's always good to be behind the patient while I do that. Thank you very much. This brings me to the end of this video of this examination.